Good afternoon. Welcome to our final seminar for the spring. I'm Larissa Duncan. I'm the director of the Center for Child and Family Wellbeing. I'm also the Healthy Minds Children and Families Specialist for Extension, and I'm pleased to be co-hosting this event with the Health and Wellbeing Institute of Extension, which we have Director Amber Canto here today, who will tell us a little bit more about the Institute. But it's my great pleasure to introduce Dr. Olufunmilola Abraham, who is a professor in the Department of Pharmacy here in the School of Medicine and Public Health at UW-Madison. She received her Bachelor's of Pharmacy degree from the University of Lagos, Nigeria, and practiced as a hospital and community pharmacist in Nigeria. She received her master's and PhD in social and administrative pharmacy here at the University of Wisconsin-Madison, and we were fortunate to entice her to come back after a job elsewhere. She received a minor as well in industrial and systems engineering. Her research goal is to improve medication use for vulnerable and underserved populations, such as children, young adults, women, and people living with serious chronic health conditions. We had the pleasure of meeting her at a recent event hosted by the Chancellor's Office and the Deans of Extension and Medicine and Public Health, who were bringing attention to the opioid crisis here in Wisconsin. And so we learned about her exciting work that you'll hear more about today, about how to work with teens using innovative technology-based approaches for safe medication use. She's also the recipient of funding from the Mortgage Center to develop a community engagement and health services research course that'll be offered to graduate students in pharmacy in the fall. So very much thinking about the kinds of work that we support through our center, through our work with Extension, thinking about how our learning and our research in the higher education context can be brought out to communities in ways that are meaningful and impactful as soon as possible. So please join me in welcoming Dr. Abraham, but first we'll hear a little bit from Amber about the Health and Wellbeing Institute of Extension. Thank you.
Thank you. Thanks, Larissa. I'll be very brief. Hi, everyone. I'm Amber Canto. I'm the director for the Extension Institute on Health and Wellbeing. So the Division of Extension is the education and outreach branch of the university system. And so we have an office in all 72 Wisconsin counties, and the work we do spans a number of different topical areas. The work I'm most closely directed to is looking at the promotion of community health through multi-level change models. So not only direct education, but advancing change in policy systems and environments, such that everyone has the opportunity to live a healthy life. So within that, we focus on chronic disease prevention, healthy eating, active living, and more recently, we're building out structures around our behavioral health components. So looking at the social and emotional well-being, mental health promotion, and substance use prevention. So work we've been doing for a long time, and now finally creating some structures of support in a different and sort of more intentional way. So happy to be here, happy to co-sponsor, and looking forward to today's presentation.
And I will just mention that it's the end of the semester. We'll have a few latecomers from a class that's ending in just a few minutes, but we also have an audience of Extension educators and colleagues from across the state who are participating via live stream today. So they are watching, and we'll have the chance to chat with Carmen Miyamiko, who's over here, our new Extension Administrative Specialist, who we're welcoming to Sohi, who is helping us with the logistics for the event. We have other colleagues also with us, just participating virtually. And Dr. Abraham has graciously offered to answer questions throughout the talk if they come up, and we're hopefully going to have a chance to try out the game that she'll be telling us about. So with that, Dr. Abraham.
Good afternoon, everyone. Thank you so much for having me. I'm really excited to be with you today. I want this to be more of a discussion, so please interrupt me at any time, ask questions, share thoughts. I have a lot of slides prepared, but a lot of them are graphics towards the end. So again, please feel free to interrupt me. So today what I hope to do is talk to you about pediatric medication use and why we care about this topic in terms of safety and risks related to the medication use process. I hope to highlight the key role that parents and children play in terms of medication use and safety, and talk a little bit about how children have told us they want to learn about their medications, and talk about innovative ways through game-based learning in particular, how kids want to learn using such techniques. So, and I'll share with you kind of what our history has been related to this. So I wanted to first start with this statement, which is 30 years old. It's from a report that is exactly 30 years old tomorrow, May 2nd, 1989. And so for about 30 years, we've known that improper medication use is a problem for children of all ages, all ethnicities, every social economic group. So this is not a problem that's particular to any specific part of the population, but it really affects all of us. And what I'll share is my personal story, why I'm very passionate about this topic. When I was 15, I was diagnosed with a chronic illness that would involve me taking medications for the next 15 years of my life. At the time, my parents figured out that I was old enough to kind of use the medications that I needed. Unknown to them, after a couple of weeks of using the medications, I realized I was having side effects that were affecting me in school. Didn't tell anyone, not the doctor, and no one in my family, and I just stopped taking a lot of my medications. What I didn't know at the time was that would have made me go blind. Because no one really explained to me what disease I had. I kind of knew the name from overhearing my parents and the doctors. And it wasn't until I went to pharmacy school and I started learning about different chronic conditions and different medications to treat this condition that I realized I would have gone blind. So that changed my perspective completely. So that's kind of how I got interested in knowing that young people were really neglected in terms of medication management and equipping them with the skills to realize the consequences of safely using medication. So that's kind of how I got interested in this. And then about 6 years ago, I got funding from the Community Pharmacy Foundation to start to look at how we as pharmacists could do a better job in engaging children whenever prescriptions were picked up in the pharmacy. While we were collecting data, something really sad happened. So we were collecting data from pharmacies, chains, and independent pharmacies in Pittsburgh and North Carolina. And in one of our chain pharmacies in Pittsburgh, a teen who had diabetes died. And she died because she was embarrassed to take her insulin in front of her peers and stopped taking her insulin, similar to my story, and never told anyone. So it was a really scary event at the time, but it's kind of helped me to really care about this. And again, like I'll talk a little bit about the opioid crisis and how this all weaves into that. So this line of work is very near and dear to my heart. So first I'll start with the prevalence of medication use, and why I like to highlight this is because a lot of times when we think about medication use, what population are we thinking about are often take a lot of medications? Old people, right? But what we don't realize is that children take a lot of medications also. Within the last 20 years, children are taking a lot more medications, both prescription medications and over-the-counter medications. So I think it's something that's kind of snuck up on us, and I could say from a pharmacy perspective, we often are not thinking about it. But when we collect data, what studies show us is, at least in pharmacies, we dispense over 263 million prescriptions annually. And we know that over 6 million children have chronic conditions that require regular medication use. And within a 2-week period, you could have over 13 million children taking prescription medicines. When we look at pharmacies, when we do observational studies in pharmacies, we know that pharmacists, at least in a day, will fill 10 prescriptions for children. So what I just shared with you is predominantly prescription medications. When you add over-the-counter medications, you have additional issues. We know that a lot of children start misusing cough medication that contain diphenhydramine. Which has a lot of safety issues. So when you think about over-the-counter medications and prescription medications, it's a really significant problem. So aside from this though, what we realize is despite the fact that children take a lot of medications, we do very little to engage them in conversation about medication management. So that's kind of why this is very important. So typically what are kids taking medications for? Acute conditions, chronic conditions. Like I said, this is thinking about OTC and prescription medications. And what is critical is this starts from infancy. Parents play a really critical role. And what we often see, at least from the pharmacy perspective, is that the mothers are often really big in obtaining the prescriptions from the pharmacy, administering those medications. So why does this matter? Because they're key in terms of modeling good medication use behavior and actually helping kids with learning what to do with their meds. And this is really important because I was sharing with Lauren that when I was at the University of Pittsburgh, we started this study where we were looking at college students that had just come on campus, and we did a survey. And what you often see is the parents have done a lot up until they get to college, and it's the first time that they're solely responsible for getting their medications and doing all kinds of things with their meds. And so they're calling home all the time and trying to figure this out. So really, really critical in terms of medication use. So what are some medication safety concerns that we commonly see? We know that about half of children do not take their medicines properly. And adolescents in particular, and I'll shed more light on that later, are particularly more likely not to take their medications as prescribed. We know that a lot of dosing errors in children are 3 times more likely to cause adverse drug events. And according to the CDC, you might have about 200,000 ER visits for pediatric patients related to adverse drug events. So now more than ever, we know that really doing more education for children and their caregivers is especially important to prevent a lot of medication use errors, misuse, and abuse. Questions so far? Any questions? Again, feel free to interrupt. So there are 5 types of improper medication use that we typically know happens in this population. One is you stop taking the medicine too soon. You have that antibiotic within a day or 2, you feel better. You stop taking it, we know that causes a lot of antibiotic resistance. Or you don't take enough of the medicine, or you refuse to take the medicine completely, or you take too much. So a lot of overdose causes a lot of issues. And very common with adolescents that we're seeing is this last piece of taking medications that weren't prescribed for you. And I'll kind of shed more light on that when I show you how our game was designed. That's a very common issue where they're learning from their peers, and I might say, I have anxiety, I'm taking this, you could take this pill to make you feel better. So that's a pretty common one that we're seeing with teens. So what are some consequences? Why do we care? We know that a lot of improper use causes a lot of dangerous health outcomes. We know it causes a lot of treatment error. And what I mean by this is a physician might prescribe a particular drug and think it's not working because you're still presenting, but not realizing that they never took the medications or they didn't take it properly and either increase the dose or change the medication. Right? Because they never checked if they were really adhering or if the parent and child really knew how to take that medication. Again, there are a lot of life-threatening adverse events that happen from overdose. Unpleasant side effects are pretty common. And then there are a lot of costs in terms of diagnostic costs, treatment costs associated with improper use. And again, big in children is a lot of accidental poisonings that happen from leaving unused medications in the home. So those are some of the serious consequences that we see. So there's 7 factors that we know that contribute to improper use, and I'll kind of shed light on each one of them. So one big one that we know is parents, children, and health professionals. We do, I can speak from the pharmacy and even when I practice, we do a really poor job of communicating about the medicines. We know that a lot of times if you assess what parents' understanding of the medicines, who was the primary person we spoke to, most of the time they're really not competent in terms of the dose, the duration, and all of that. So we do a really, really poor job with educating parents and educating teens directly. Another big factor is parents often do not adequately monitor their children's medication taking, and that's why I shared my example. Pretty common, you get to that adolescent age and you think they figured it out. We tend to see a lot of this too with chronic conditions where you think they've been taking this for a long time, they should kind of know what they're doing. Another common one that we see, at least from the pharmacy perspective, is this idea of the fact that modern life, family life, tends to affect safe and effective use. A lot of times people have busy schedules, they're not picking up their children's scripts, or they come in the pharmacy, even if you want to talk with them, they're really, really in a hurry. Or another pretty sad one is when you have divorce, where the kid is split between different homes, and one person typically picks up the medication, one person is aware of the medication, one person is not. And so that's a big problem we also see. Also, just parents and children's negative attitudes towards medications, maybe thinking it doesn't work, it's not natural. And also parents being poor role models. And why this matters is just like we see in kids, older people also about 50% of the time don't adhere. So those are the people that are passing down those kind of habits to younger populations. Another critical one are a lot of psychosocial barriers. So an example of that with teens is kind of like I shared with the insulin story. A lot of times adolescents are worried about how using medications affect their appearance, their acceptability amongst their peers. And then the last piece, which is very near and dear to my heart, is this idea of schools. I feel like schools are inadequately really prepared to help educate. Even from the pharmacy's perspective, we're developing programs right now where I'm taking our pharmacy students into high schools to educate about safe and effective use. And that was something we started in Pittsburgh that we realized a lot of the students really resonated with. The pharmacy students love it because they don't get a lot of pediatric counseling experience. The students in the high schools really enjoy it because they feel like they can really resonate with them and ask them questions that they might not be comfortable asking a teacher or someone that's older. So we really believe that we could do a better job including safe and responsible and appropriate medication use into the health curricula in schools. Any questions so far? So what age group do we really care about? Like I said, because adolescent is a common time when children begin taking on more responsibility, I always strongly recommend that. I think it's a timely phase in a child's life when we want to do a little bit more. A lot of studies show us that at age 12 is really a good time to introduce the idea of autonomy, especially around medication management. But you want to do it gradually and with a lot of supervision and also including a healthcare provider. So a lot of my studies started off trying to understand what pharmacists taught about this topic, how kids thought about their medication use, and how parents also thought about that pediatric medication use problem. So here I just kind of highlight some of the things we found. Interesting to me, a lot of times we see that adolescents, specifically with chronic conditions, have expressed a lot of fears in that and concerns about having to be solely self-managing their medications. And what at least I found from doing this line of research is sometimes that was never communicated to the parent. So very, very interesting. And so the other thing we see is that the healthcare providers also have to do a better job once they're transitioning to that self-management piece. So for example, my lab does work with young people with cystic fibrosis. So if you know anything about cystic fibrosis, there's a movie 5 Feet Apart that was showing in the cinemas that kind of highlights this. But if you know anything about people with cystic fibrosis, they take about 8 to 10 medications daily. Some of their therapies can span 1 to 3 hours. And so what we realize, for example, with cystic fibrosis is when they're transitioning from being pediatric patients to the adult CF clinic, it's a really critical time that you just see their adherence and their quality of life drop, and they end up in the hospital a lot, right? So we've realized that transition period is a really critical time. And the other interesting thing that I've seen from my research is that children want people to directly speak to them. And typically, even in the pharmacy, and I'll share some of the data we found, they might be there, but we don't talk to them, or everything is directed at the parents, so they feel left out. So what some of our studies have shown, so we did these direct observations in pharmacies in North Carolina and Pittsburgh, and what was interesting to me as a pharmacist is pharmacists told us that they will typically communicate with children about 30% of the time, but when we did observations, a lot of times, even when the children, so we were studying children 12 to 17, they barely spoke to them only 2% of the time. So we realized that even when the kids are there, we're really not talking to them. So it's a missed opportunity. Any questions? Happy to shed more light or share. If those articles are interesting, I'm happy to kind of share those publications. The other interesting piece about this line of research that we discovered is, this surprised me a lot. When we started asking children in our study what they wanted to know about their medications, these were the last things I expected to discover. We had children telling us, I want to know the pharmacodynamics of my medicines. And I think if I had designed an intervention in pharmacies, that probably wouldn't have been included. So that was really interesting to us as we started to think about what interventions made sense. And they were telling us, you need to show me how, when I take that pill, what it's doing in my body. That will help me understand why this is important. They wanted to know how they were manufactured, research around the effectiveness of these medicines, the history of the medication, side effects, and safe use. So I was really blown away, and it showed me that we really had to have kids as partners in our interventions, even around how they wanted to be educated about medicines. So typically we ask questions about, so how do you learn? Where do you get information from when you want to learn about medicine? A big piece is their doctor, and this is aligned with the US Pharmacopoeia that strongly emphasizes that we directly speak to children about medicines, a lot of times from parents and family members. A big piece when we've done our work with opioid is the internet. So they're looking with opioids, what we've heard is they first go to the internet before talking to anyone else. So, and then their peers, of course, are a big influence. Any questions so far? Please feel free to interrupt. I really don't mind. So over the time of doing this work, we've learned some pearls of how, what helps. So a big piece from everything I've said is you definitely want to be focusing on the child as the patient. So, and I feel that sometimes what gets lost is the parent almost seems like the patient, but we really want to remember that the child is the patient, and we want to focus on the child as the patient. Really critical is communicating at a level at which they can resonate. So really thinking about not using jargon, so similar good communication principles. A big piece for children that I've learned as a pharmacist is really starting with open-ended questions and really encouraging them to ask questions about their medications, because when you don't realize what they don't know, even when they've been taking the medications for a long time. A big piece that we know is get them engaged. Get them involved in picking up their medications and give them tasks, especially from the age of 12, and also supervise what they're doing and show them that as parents, we've seen, or healthcare professionals, that we care about their medication use process. So as I continue to do this work, some of the things we started to look at was we started to ask, so how do you want to learn about your medication? And a big piece that came from our studies with parents and children was you need to think about interactive technology that can engage us. And at the time we were thinking about kiosks, we were thinking about a bunch of different things, and then they told us, could you use games? So I wish I could say that was my brilliant idea, but honestly, I'm not a gamer. So that was a big challenge. Like, okay, we'll figure this out, what this means. And they've kind of walked us through that process. And so that's how we started looking at, can we use games? What will this look like? So why did they suggest games? So what we've seen is a lot of times when you go to the pharmacy, for example, you get a lot of paper about your medications that how many of us read those sheets? None of us, right? So at the end, you learn nothing. A lot of times, for example, I'll pick on cystic fibrosis because that's what I do work with. You're in the hospital, you're in the inpatient setting, and they're just telling you a lot. How often do you remember that? The environment for providing that education is just, it's not the right environment. You're overwhelmed, you're struggling, you're just going through a lot. So a lot of times it's just not the appropriate or conducive environment to provide you with the right information. Sometimes you're getting information from the nurse about your medicines, you're getting information from the pharmacy, you're getting information from the doctor, and sometimes that information is not always consistent. And so a lot of times what we've seen is a lot of this can lead to people feeling overwhelmed, even more confused, and knowing very little in terms of their competency in managing their medications. So we started to look at what would it mean to take a game-based approach to our typically passive way of educating about medicine. And so what this means to our research group is really combining the idea of, let's see this word, game development, principles from learning sciences, and principles that we know about medication safety. So that means things like goals, participation, practice, feedback, and showing people consequences through gameplay. So why use game-based learning? One of the things we've realized is that retention of information is typically longer. One of the other things that we usually see is this idea of perspective taking, and we realize that one of the things I've enjoyed the most is just seeing how the classroom changes in high schools, and they start talking about what happens in their homes, about medication. So it's really, really fascinating. The other reason why I care as a healthcare person is that I know like the current state of healthcare is that sometimes we're just rushed. We don't really want to engage, but you might be waiting in the pharmacy for quite a while for your medications, or you might be waiting at the doctor's office where we can hopefully have something that might teach you about your medications. The other things that we've learned from teens is this idea of the need for active patient engagement. And we know that active patient engagement helps to improve health outcomes. This is more relatable to teens. It's easier to understand. They feel like they're engaged in that learning process. And from a healthcare perspective, it's more efficient if we can create ways such that people can learn through this approach. So what we typically refer to such games as is what we call serious games. So essentially, there's a lot in the serious game literature, but what they really do is they're games that are not just for entertainment or fun, but embedded in the learning and the design of the game is that you're learning a deeper educational goal. So we use this for children, adults. A lot of times you find that the parents also like the games, which is interesting. And we've seen that this just produces more motivation and more engagement. A big piece for us on the research end is 3 things we're typically looking at as we want to assess engagement. We want to assess learning. And the big thing about the games is that you can assess what people are doing and what decisions they're making within the game. So typically what you're doing with serious games is you're trying to have them have a goal, model something, have them develop a particular skill. You want to design activities that involve a little bit of problem solving, like with our game, it's kind of like a puzzle mechanics. And you want them to kind of get a big picture of whatever you're trying to teach them about. So hopefully you produce activities that are thought-provoking for a player. So why use serious games? So tons and tons and tons of studies show us that they're acceptable. People like them, especially when they're well designed. They can help increase self-management. That's the big piece. Especially so a lot of diseases, which this has been used for, like I said, cystic fibrosis, diabetes, asthma. So there's been a lot of work around changing behaviors using games related to these health conditions. So typically you're trying to increase knowledge, you're trying to deliver a persuasive message, change behaviors, and hopefully influence health outcomes. So typically there are a bunch of different benefits for using serious games. So serious games that are designed for health purposes, usually we call them G4H, so games for health. And they produce a lot of interactivity, feedback. You're able to get feedback as they play. Players often feel like they have this sense of agency and control, which is pretty interesting. A lot of times there's this idea of identity, if they can choose their character or choose their own avatar, and really they get immersed in the game when you have good gameplay, and that's what we mean by immersion. So a lot of times with games for health, what we've seen is that there are a variety of different health behaviors that you can influence. One is this idea of perceived benefit, perceived threat, self-efficacy, cues to action, and also social interaction. And that's one thing we found with our game is what it's able to do in terms of social interaction around a particular topic. So a lot of games have been designed to influence things like tobacco cessation, sexual health promotion, alcohol and substance abuse, HIV. So this is not something really new. What I would say is really new is you doing this around medication use. So that is not as common. But the good thing is we have a lot of literature to build from where this is shown to be able to improve health. So the goal of my research program is really this idea to promote safe and responsible use of medications, particularly to reduce misuse, to heighten awareness of unintended negative consequences of misuse, and to really help people who take medications make informed decisions about their medication. So right now our goal is looking at opioid as an example, and a big piece of this is we're trying to think about how we can use games to improve family and teen interactions and conversations about medications. So now I'm going to talk about our game, our most recent game that we're working on, which we call Med Smart. So the idea is to teach you to be smart about your medications, and we call it Adventures in Pharmacy. And why we have this name is hopefully we keep teaching you about being smart about different medications, and it's kind of an adventure in a city. So that's kind of the feel of the game. So our target audience, it's currently designed for people 15 and older, but we're actually testing it in middle schools. And I'll kind of share, like we were at the UW Science Expedition, and we've seen that it could be used for kids that are younger. Also parents and families, so like what we had at the Science Expedition is we were having teens play and having their parents with them, watching them and talking about what was happening in the game. Also, the way it's designed is we're hoping to have this be able to be used in health classrooms. So we partnered with a variety of different schools around the state to start testing what this might look like and using it in the classroom. So it's really interesting, and hopefully to use it in clinics and pharmacies. So what's our game about? So it's a digital game that's designed to create awareness about opioid safety, and there are key learning principles that I'll shed more light that it focuses on. One, teaching about why you shouldn't be sharing medication, safe storage whenever you're prescribed a medication, Naloxone Education around opioid misuse, and safe disposal. So those are some key things that this game targets. So now I'm going to talk a little bit about why we chose to pick on opioids, because we could have done any other topic. But one, it's a very timely issue. And for me as a pharmacist, I was just intrigued that its misuse started from the age of 12, right? So for me, it was very timely, and it made sense to kind of target this issue. The other reason why I really cared from a pharmacist standpoint was a lot of times misuse started in the home, right? And a lot of times, 40% of times, like I show on here, misuse started from getting a medication from a family or a friend. And the key things that I'm telling you were the reasoning and thinking behind how we designed the game. So when I show you the game, hopefully you're able to connect the dots. The other piece is with adolescents, we know that about 20% of adolescents 12 to 17 are prescribed an opioid, and 1 in 4 of them will misuse an opioid prescription in their lifetime. We also know that a lot of times it happens from leftover prescriptions, either for themselves or a grandmother or parent. And we know that even when they're prescribed, they have a legitimate opioid prescription, it's often associated 33% of the time with increased risk of misuse. So our game development team involves a bunch of different experts, a lot of us at the School of Pharmacy, faculty, pharmacy students, and graduate students, and we're fortunate to be able to partner with the UW School of Education and School of Medicine. So we work with Gear Learning Studios on a weekly basis that has a team of designers, developers, and they're just wonderful. And we also work with Dr. Megan Marino, who's the head of pediatrics. She's our adolescent expert, and we're fortunate to work with Dr. Randall Brown, who's our opioid misuse prevention expert. So this is kind of the team and brain behind our game. So we use what I call an agile approach, where we've spent a whole year designing this game, this first prototype. So it's designed, you have a prototype, and then we've been doing a lot of play testing and fixing. And I kind of cheated because when I was at Pittsburgh, I had worked on 2 games. So we worked on one looking at OTC safety. So by the time I was coming, I kind of knew a sense of some of the things that worked and some of the things that we needed to fix for our next medication use game. Some of the critical things that we learned is that you have to have subject experts meeting constantly and regularly, making iterations to the game. So we have a lot of weekly meetings, play testing, and the hope is to kind of roll this out over time, learn, refine, and keep rolling it out. And I've learned that as the game gets used, it gets better. That's kind of the key. So I wanted to share a conceptual framework that I spent about a year developing based off of the literature and my experience. So this framework is really what has guided how we've designed the game. And it looks a little bit more complex than it is. So I'll kind of walk you through. Essentially what I have here is what I call your in-game experience. Right? And so what that really encompasses is what's the game environment, and eventually I'll show you what that looks like, the game design and the game mechanics that contribute to that environment, and what kinds of assessment and feedback are you building into the game such that you really can affect different types of behaviors. The other critical piece with opioid misuse that was really critical is this idea of family, school, neighborhood, and a social support network. They're really key in terms of the medication use process. So these are a bunch of different factors that we hope to influence, and eventually we hope to promote safe medication use, storage, disposal, and improve decision making around medication use. Really critical with games is educating others. So a lot of times when people play games, they end up talking a lot about the game and talking about what they're learning. So that's also an outcome that we're looking at, is that hopefully when teens are learning, they're able to be good advocates for safe and proper medication use in the home. So those are the things that kind of influenced how the game is designed, and I'll show you once you see the game. There are key principles, learning goals that we first came up with. One, a really important one is managing this false perception of safety. So we've seen that with teens, a lot of times they assume a lot of things are safe because I'm getting that med from my friend, it should be okay. So that's a big piece that we really care about. And this idea of getting rid of unused medications in the home, proper storage whenever you're prescribed a medication, and really, like I said, being a positive influence on your family in terms of why you should care about safe use. And a big piece that we kind of highlight in this game are the social pressures that you might face when you have a medication or that you might see happening in a school setting. Another big piece is one, demonstrating undesirable and unintended consequences. So within the game, we've built in where you can see the unintended health consequences or social consequences or legal consequences. So we think that's pretty important. So now I'm going to talk a little bit about gameplay. Any questions? Sorry if I don't know if I'm going too fast. Yeah.
I have a question. You said that 20% of adolescents are prescribed opioids every year. What are they prescribed for? It seems like what
Can anyone guess the most common time a teen gets their first opioid prescription?
Wisdom teeth.
From the teeth.
Wisdom
From the dentist. Can you guess the other next time when they typically might get an opioid? The sports injury. Critical. And so our game is designed around sports injuries. Excellent. Any other questions? I dive into gameplay? Really good question. But typically, most people don't know, but the first time a teen, most often than not, will get an opioid is from a dentist. And they often get way too much than they really need. And then they just have it at home, never get rid of it. Any other questions? Yeah.
Is that sort of, you said they end up having it at home and then they never get rid of it. Is that the main sort of reason that they end up misusing it, or is there like sort of a slide into dependence?
So a lot of times when they're getting their prescription the first time around, for the most part, it doesn't lead to dependence. Mm-hmm. At least to my knowledge, most often at times you have a lot of them at home. Has anyone heard of what they call farm parties? Are people familiar with those? So that's a big piece where we're telling everyone, bring your meds, bring whatever. So a lot of times they're ending up starting with medications that they don't even know what are at those parties. Okay. So I think that's more of what leads to dependence and not that initial prescription for the most part. Okay. But great question. Are there any other questions before I keep going? So, good questions. Okay, so I'll talk a little bit about the gameplay. So it starts off, so really good segue. It starts off with a player who's been prescribed an opioid for a legitimate reason. They have, a lot of kids are into sports nowadays, so we kind of picked on sports. And they have an injury and they've been legitimately prescribed a pain medication that they now have the responsibility to manage. And within the game, they face pressures of how to manage this medications with their friends. And a lot of the game design elements focus on really our 8 what we call our opioid safety core principles. And within the storyline, the teenager has to make good decisions about handling this opioid and make choices within the game. Critical that you kind of see is we've taken this Groundhog's Day approach where instead of like losing your life, you get to relive your life and do it all over again. Is kind of the approach we've taken. So I think I'm going too fast. I'll just share a little bit about the graphics that you see in the game. So we decided to go with animal type characters. People find them really appealing, and I'll show you what those look like. It's a 2D side scroller game. There are time loops where you can kind of go back, relive your life again. Built into the game, we're still working on this. We find that people like to collect things or have a way that they're collecting things within a game. It's a mechanic that people enjoy. And for the most part, there's a player, and then there are a lot of NPCs, so like non-player characters that are dialoguing within the player within the game. So here I just show a picture of that kind of looks serious, but what we were really trying to do was kind of balance this idea that, you know, this is a fun game, but this is kind of a serious topic. So we've tried to build that into the graphics of the game. So anthropomorphic characters, one of the reasons why we've chosen to do this is a lot of times is this a girl or a boy? Can you figure out a gender? No, right? So sometimes people will tell us, oh, it's this, it's that. So that's why we've gone with anthropomorphic characters, is hopefully keeping it somewhat neutral, and they still have human faces, so you can still give them a personality, give them different physical characters. So I just thought I'll show you like our collection of different characters that eventually you'll be able to choose from. And what we could do with these characters is we can have them have all kinds of different emotions or expressions, or kind of shade them out in different ways, if that makes sense. So we could play around, like make their eyes pop out or make them look more normal. So there are all kinds of things we could do with that. So within the game, you have all kinds of environments. So if you might remember from the conceptual framework, we talked about the home, the school, and then kind of like the neighborhood, your network. So we've kind of built in like the bus, and these are like examples of different scenes that you can have within the game. So another critical piece that we've tried to do is we've tried to use large shapes, make them visually appealing while still not distracting, is kind of what we were going for. So now I'll walk you through different levels of the game. So typically you have our first level, which is at home. So remember, you have that player that's been prescribed a medication. And so this is the player over here. He or she has broken his arm, and now he has to manage his medications, and then his friend comes over. And so in this level, what we're trying to teach is that you have to be cognizant about where you store your medications or their consequences, and you kind of experience that as you play through the game. So in this level, to kind of win, you have to learn, figure it out, store it properly so your friends don't get a hold of it, and then you're able to move on to the next level. So again, throughout the game, they have options for how the direction of the game flows. If you make wrong answers, you see the consequences. And again, you have that time loop. So this is typically what the time loop looks like if you're making poor choices. We also have a second level, like a ride to school. So we're trying to make it like your typical day from home, you go to school. And within the bus level, there are different opportunities to interact with someone on the bus and kind of engage around medication use. And we have 2 bus levels, so I'll talk a little bit more about that in another slide. We also have a school level where we've tried to mimic interactions in the classroom. You have to give a presentation, but you have to use your medications. You go into the bathroom, you can have conversations with another student and decide whether or not you're going to share your medicines. Another big piece that we've designed into the game is, like I said, it's critical for them to see consequences. So one of the consequences we wanted to highlight were the medical consequences and costs of misuse or overdose. So we have a scene where you kind of see the person going to the hospital after misusing a medication. And then again, like I was saying, on the bus ride home, so you can also go on the bus to school and then you can take the bus back home. You have opportunity to see another passenger who's in pain. So, and having some discomfort, you have the option to kind of go over and kind of dialogue and decide whether or not to help them out and figure out if sharing your medication is a good way to help them out and kind of learning from that. And so again, what we've done with the bus scene is that you can experience an overdose on the bus to see why you shouldn't do that. And then we also try to weave in Naloxone Education. That's pretty important for us as pharmacists, where the bus driver can come over and administer Naloxone to get the player back to life. And then within that, we have opportunities where a paramedic can come in and kind of talk to you about what Naloxone is and all of that. Another level we have is just kind of shedding light on this idea of proper disposal in the community. For example, in a pharmacy, some pharmacies now have kiosks where you can dispose of your medications. So we kind of highlight that in this level. Throughout the game, we have in-game dialogue whereby it kind of directs the flow of the game, and you're engaging through the cell phone mechanic, and you're kind of learning through that process as you're engaging in that conversation. So for us, some of our next steps is to keep improving playability and seeing how this tests out for different settings. Hopefully disseminating this at some point and improving that dialogue. I think we have a lot of work to do in figuring out what dialogue makes the most sense. So we've gotten a lot of feedback from teams. And eventually, so right now the game is only playable on the computer, but we want it to be playable on a smartphone, on a tablet, but that's a little bit more expensive to do. So we're trying to figure that out, but we want this to be accessible in rural communities. And I know like having it just on the computer is not sufficient. So we're working through that. So like I said, a big piece for us is playability. We want people to be able to play this in school, play this at home. And so I wanted to kind of share with you about some of the play tests that we've been doing. I tend to have fun with these. So we started off in La Follette, for example. The kids were great. So I think we first play tested with over 50 kids. So while we were designing, our team was play testing with a fewer, but then once we felt like we had a reasonable prototype, Then we started to roll it out in different community settings, and these are only examples. So we've tested it with 52 high school students, over 100 families at the UW Science Expedition. We've tested it with undergrads, so we bring them into the pharmacy school and have them play and kind of see what kinds of conversations they're having, and with our pharmacy students that are really passionate about appropriate drug use. So a lot of the things that we're seeing is people like it's really fun, they love the scenarios, they think it's interesting, there's a lot of learning that's happening, and this is just a word cloud as we're analyzing our data feedback that we've gotten about that from the playtests. So what do people typically like? They say it's engaging, it's fun, it's interesting, they like the design of the characters, the graphics, and one of the things I enjoy that I do when I'm part of the playtest is, so what's the game about? So what do you learn? Because we go in really cold, we tell them nothing. We just say, you're gonna play this game. And then we ask them, what are you learning? So what was that game about? What did you learn at this level? And you really be surprised, even with almost no instruction, people figure it out and they start talking amongst themselves. So that's showing us that we're kind of meeting some of our objectives. So some of the things we know we still have to work on are the instructions, especially if we're going to use this in classrooms, giving better instructions about the control, improving that dialogue, like I said, and working through some of the technicalities of the game. So typically what people will say is, oh, I learned about adverse effects associated with medications. I learned not to share my medications. I learned ways I could store it. So like in the home scene, I kind of don't want to give it away, but just in case you don't play, you have to keep it in a locked cabinet, which is recommended. So it takes people a while to figure that out. And I learned how to safely dispose of my medicine. So for us, we're getting this feedback as people play. So that's kind of all I have. I'm happy to take questions, and you have opportunity if we have time, if people kind of want to play through. Please go ahead.
I know you're sort of right in the middle of all of this and making improvements and stuff, but have you given thought to like the next, like you said, opioids are kind of timely and the effects, I suppose, are much more dangerous than other medications, but have you given any thought to like what you would tackle next?
Oh my word, I've known that for a really long time. So I had to restrain myself to work on only opioids. When I started off, I actually didn't want to work on opioids because there were a lot of medications. Even through collecting data, I've had kids come into our playtest in the game studio and say, I'm taking anxiety medication, ADHD medication. There are so many meds. That's why we designed it as Med Smart, teaching you about being smart about whatever medications and kind of learning that. There's just so OTC meds. So right now, do people know what loperamide is? You actually do. Imodium do you know Imodium? That's loperamide. Do you know it's an opioid? How many people know Imodium is an opioid? Right, it is. So it's I might be saying it with my Nigerian accent. Imodium.
That's correct.
You said it right?
The anti-diarrhea.
Anti-diarrhea. You've probably, it's an OTC, but it's an opioid. Guess why that matters? Can anyone guess what's happening? So people who can't get access to opioids are buying tons of Imodium, right? Because they know in really, really high doses you can get slightly close effect, right? So now the FDA is actually changing how Imodium is packaged such that to kind of limit how much you can buy. OTC medications, diphenhydramine, that's what I started off with diphenhydramine and cystic fibrosis. There's so many meds, ADHD medications, anxiety stimulants, there's so many, there are tons that we need to be studying and educating about that are commonly used in this age group. It's more of, I've learned over time from doing this 3 to 4 times that it's good to kind of focus on tailor each game. So right now how we have it is it's kind of like a city and you can learn about different things depending on what you're taking. But part of it is also funding. This costs a lot of money. So hopefully if we have more funding, I really want to design this such that we have an obesity game prototype, not a full prototype concept that we're waiting on funding. We have one for cancer prevention education. So what I'm hoping is we can have it such that we're educating about different things in classrooms, in schools, meeting kids where they are. There's so much you could do, and we're fortunate to have the manpower here at UW to do it if we have funding.
Great. This is less of a question and more of a statement, but earlier you kind of saying some of the reasons or some of the things that teens think about prescription medications, and one of them being that they don't think they're as risky, or there's less of a kind of a negative consequence potentially. But I would guess that parents actually have quite similar perceptions of prescription medications, and that youth, when you really talk to them about it, they know that it's probably not good to be, taking them in different ways, but compared to other maybe street drugs or other illicit drugs, they're less, they have less negative consequences. So it'd be interesting to see how the young people playing the game then interact with their parents or talk to their parents about the risks. I bet a lot of parents don't know a lot of these, a lot of these facts or a lot of these strategies.
You really just picked my brain. So I'll share a story. When I was at the University of Pittsburgh, we'll do these things where we'll have because Pitt and CMU we had a ton of game designers, so it was just a fun environment. And there were people who were designing games for asthma, all kinds of things while we were doing this. And there was the head of the system, one of the people in the pulmonology clinic, that said when he'll have his game in the clinic, the parents were saying, you have to design this for every disease and every medication, because it was creating opportunities for them to, for the first time, have intentional conversation about the disease and about the medication. So what I see, one of my primary goals is to really see how this changes conversation in the home about medication management. You're spot on. Yes, sir.
I have a question about how you thought about educating children about the risks. Because it seems like you had the one slide of the character visiting his or her friend in the hospital because the friend had taken medicine that she wasn't supposed to take. And I remember when I was in high school or middle school, hearing, marijuana is really bad. But then once my friends started taking it, and I realized, started smoking it, I realized lots of people are using this. Maybe all of the propaganda that I'd heard, maybe everything that my parents had told me was wrong because they've never tried it. And I have all this personal experience where friends are now using it without serious consequences. And it seems like there's always a risk in this kind of work of, emphasizing the bad potential consequences which are out there, but not being able to share with the adolescents the relative risk of what those really bad consequences are. And so they have lots of personal experience where those really bad consequences don't actually happen. They go to these pharma parties or whatever you were talking about and see kids who do take medicines that they shouldn't be without negative consequences, and actually quite positive, immediate consequences. And I was just wondering, how do you think about trying to navigate those really complicated issues?
I thought about that a lot. Thank you so much for your comment. So one of the things that you see that I talk about a lot is, to me, as a pharmacist, my research program is not just to highlight the risks, because I do work with people who have legitimate serious chronic conditions. So in my opinion, what we want to be doing in schools or at home is really teaching this idea of safe, appropriate, and responsible use. So really getting away from the idea of trying to scare you, because medicines can really help improve our quality of life if you have legitimate health problems. But what I really think we need to be doing is really creating this idea of what does responsible use and appropriate use looks like. So it means if you have a legitimate condition, if medications are prescribed, you want to take them. We want to improve adherence. If you don't have legitimate issues and people are offering you prescriptions, you at least want to know what they are. Where do they get them from? What is it? And even highlighting the idea that they're illicit substances and you just don't know. So I think I'm not for the scare approach, but I'm really for the approach. That's why we designed it such that you have a prescription. And now you're tasked with the responsibility of doing what's right, and you kind of have to make those decisions. So that's more the camp I'm in, is really equipping them that you're going to make this life choices. Your parents are not going to always be there. And the opioid crisis is just an example of how it could lead to severe consequences, and you kind of want to care. That's kind of how I think about it, is more of as a life skill. Kind of like we teach about healthy eating and things like that, and realizing this is just part of also good behavior. That's kind of how I think about it. I don't know if people have other thoughts. I'm open to learning.
Do you do much to teach the children how to resist if other
So
characters?
within the game, we have that built in, where you're going to have to make decisions where you're offered, or you could be the one doing the offering, and you're going to have to think about that, what you want to do and why. So for me, also pretty big is I design the games not necessarily to be used in isolation. For me, I see, that's why I said conversations. My presentation is intentionally titled Conversations, where I hope it sparks conversation, right? Between teachers and students, between parents and children. That's really what I hope, between the healthcare provider, such that we start realizing, what are they thinking about medications? What do they want to know? What don't they know? So like you said, if they're seeing people misusing medications and not having consequences, let's talk about that, right? As opposed to just not doing anything. So that's kind of how I see the game being used. Other questions? Great.
So I think it's great that the learning goals are very focused for this game, but you also mentioned that children, when surveyed, are interested in learning about the basic pharmacodynamics of these drugs, the history of the drugs. Have you thought about opportunities of bringing in that knowledge into the game?
Excellent. So remember how I talked about, so one of the things we've learned is you wanted to target specific issues. So with cystic fibrosis, for example, so my lab does work with cystic fibrosis, that's pretty critical, because they're so overwhelmed by the number of meds they have to take that you really have to kind of, so what our cystic fibrosis game, so I was developing this in Pittsburgh, unfortunately I couldn't carry it over here. So how that was designed is they were kind of like, and how would I put it? They were kind of someone who had to kind of fight their disease and kind of see how when I take that specific medication, how it helps make my lung function better. So for those kinds of conditions, that's how we design those games. Is it showing you how when I take that medicine, what's happening inside, what cell function or what organ function is improving. Does that make sense? So that's how we design those. Great question, by the way. But yeah, at least what I've learned for different conditions, the game design has to be slightly different. The key pieces I realize is you have to have a good understanding of the disease and good understanding of how the medication, the mechanism of action of the medication, and bring all of that into gameplay so it's realistic. So that's also the big thing, is you have to design a game such that it mimics some aspects of reality or it's not believable. Good question.
Can you talk about how long it's taken you to do this game and how much money you've already invested and how long students or children engage with the game?
So, like I said, I kind of cheated. So it's taking us about a year to get it to the point where it's at, we wanted a really good prototype. But I've done, I'd done a lot. I designed two, and I was right in the crock. So I kind of came here ready to jump in. I just needed to decide who's my game development team, since I couldn't bring them from Pittsburgh. So I'll say right now, because I've done this so much, it's a little bit quicker. If it's a disease or a condition that I have a good grasp on, so I've been doing medication safety work for many years. I started off looking at errors happening in pharmacy. So I also had a good understanding of the medication safety literature, the opioid literature. So I think, like I said, it's about the experts that you have. I was fortunate to have Dr. Brown, an opioid expert. So we wrote a paper together. That paper drove all of what went into game design. So that affects gameplay, game design. With obesity and cancer, our cancer games, I've had a lot more learning to do, but what I typically do is find the experts, and we know the serious game literature enough that we can build off of that.
Mm-hmm. And then what was the budget and how long were the students?
So we started off with a $100,000 prototype budget, it costs more. That's the honest truth. And now I know my game design team has some supplement funding from the Department of Public Instruction because they're really interested to help work on this in Fair Play, which is a game on racial bias. So again, we're looking for more funding to kind of build this out, and like the person had asked, have this for different medications. Great.
A question from our remote viewers.
Oh, I'm sorry, go ahead.
Oh, no, it just popped up. Are you looking for students to pilot this with? I have a group of middle school youth that I could potentially pilot with in an after-school program.
Yes, so we actually started doing after-school programs. Yes, we're very interested. Please email me your information. So one of the things we learned when we tested this at the Science Expedition, and our game development team has been testing this in middle schools, is yes, we really believe younger kids can also play. And so we're looking to test that and just assess that that's actually a correct assumption. You were going to ask a question.
Yeah, I was just thinking about Rob's question related to sort of that concept of peer pressure and peer networks. And I'm curious if you have any insight around social desirability and any effect that that might have, such that, you know, with older adolescents, they may know the right answer is not to give somebody the medicine and therefore make that choice in the game depending on the dynamics of how they've been exposed to the game, but may still actually do it in practice, like in a day-to-day context.
So I completely agree. So we haven't tested that. We've had that where we see they're on purpose doing that, failing in the game or doing what they're not supposed to do. But I guess the way I think about it is I think you want them to do that. And then you want to talk about, so why are you doing that? You know, what are some of those consequences? What have you, and some of them have family members who suffered some of these consequences. So I've seen it depends on the teen. But like I said, I think the biggest thing is sparking this as an ongoing conversation. But in reality, you can't always prevent what people do in real life. But I think you want to at least provide them with the skills to make the right decisions, make positive and informed decisions. But yes, you do have that. Valid, very, very valid. Other thoughts? Very insightful.
How long do the students play the game?
So typically they want to stay on it for a long time. So usually we take an hour of our classroom time because we have different levels, but I'm finding it's not enough. It's not, I feel like we're always rushing them. You need to, again, because we want them to try our different levels. But really, a lot of times, they don't want to move to the next level till they finish that level. So some of the things I told them, like, you might have to come over to the university so you have more time to play because your school only gave us an hour of a time period. So one of the things I've thought about, which is why I care about building it into the curriculum, because what you could do is that you could have them play each level. And some people who are gamers might figure out the puzzle mechanic and finish it quicker. Is you want to have it as an ongoing thing within their health curriculum where they don't feel so rushed. And then you could have a conversation. So one of the things my lab will be doing this summer is we hope to be developing curriculum and additional information to supplement different levels of the game, such that a teacher can know how to use this in the classroom, is one of the things I really care about, and additional information that they can provide and resources that they can have at their disposal. Yes, 1 hour is not enough, I found. I've always felt like we're rushing, literally rushing to the next class. Yeah, we feel, they are engaged. So I can tell you the one thing, they're very engaged. We've not had an unengaged classroom. So that has been interesting. And the fun thing is the teachers are usually sitting there and watching their classroom kind of change. Because what we do is we typically have them in circles. So you have a circle of groups where they're trying to figure out who finishes it first, who figures out what to do, and they're just chatting away. It's pretty cool.
So if we go to this address.
Yes, does it work? If anyone has their laptop, you can play through. I have my research assistant, Maylee Tidd, who can also help you work through it if you want to see what it looks like. I feel like I said a lot, but I kind of want you to be able to go in and kind of get a feel for it.
And it's pulled up on browsers. So if you close it up,
this is a shorter link than this. And if you have any issues getting in, Meili and I can help you.
It doesn't work on phones, I try and.
No, so that's what I said in terms of portability, hopefully when we have more funding. So it's actually more expensive to develop for an app, for a phone or a tablet. It's cheaper to use WebGL on a computer. So usually because you know you might still have a lot of issues, you don't want to develop for a phone until you have one that you're sure doesn't have a lot
Do
of
you know
issues.
if it works on Chromebooks?
Yes, it does. We've tried it on Chromebooks. Oh, you weren't at that playtest. Yes, we used it on there in Chromebooks in schools.
Because I know a lot of schools use the Chromebooks.
That's what we use. That's what, when we play test in schools, the link works fine. Yeah, that was a critical need. Yeah, so it works fine. We've done it like on 60 Chromebooks or more. Are you able to log in? Yes. So if you click on the blue button at the bottom, you can see it in a bigger version. So you can click on New Game. Can I pull it up here?
Yeah, it's preloaded on a couple
Oh, sorry.
browsers there too.
Sorry.
Close out PowerPoint.
So you can click on that blue button at the bottom, click on New Level, and typically it'll take you to, this is just how you travel between different parts of the city. So usually, like I said, you start off in the home level. So let's see.
So is there sound, is there music?
Not yet. So we're working on that with our development team. Apparently, there's a lot of work that goes into what voice is selected, what background music to kind of work with the pace of gameplay. So right now, you don't have that. So that's like the prescription. Those are the friends. And you can kind of jump, move, go into the refrigerator if you need to get soda.
And so how are you moving?
Oh, with your arrow buttons. Meili, can you help?
Yeah.
Oh, yes. I'll help people on this end. So this is the time loop. So remember when I talked about the time loop? So when you do the wrong things, that's how you get to live again. So you have the chair. You might need it at some point.
If it sits, it fits. That's awesome.
So this is kind of the lock cabinet where you can store your medication if you want to. I could show you a new level.
Yes.
So,
The keys, like, in the house.
Okay.
Yeah.
so if you click on level select, also you can kind of see our different levels. So this is like the bus scene. I'll just kind of show you what the bus scene looks like. For those of you who don't have a computer, I'll just kind of walk you through the different scenes. So this is I just want to walk you through kind of like the city. This is where you get on the bus. So just showing you what so this is Pharma City, kind of like the city within which the game is built. So this is kind of an example of where you could dispose of your medication in the pharmacy in a different level. So I could show you the school. So this is like the high school scene. Any thoughts so far as you're walking through or questions? So this is like the high school scene. So like I said, we're kind of working on the dialogue to make sure it makes sense and the pace is okay.
Hit the key.
So the character's friends are wearing varsity jackets. And, you know, I don't want to subscribe a gender to them, but they look awfully male.
We can work on that. That's good. It's funny. Can anyone guess if our artist is male or female? The artist who helped design the game. Can anyone
I'm
guess?
going to automatically just assume male just because of stereotypes.
Right, but not. So it's pretty common. So in the past, when I work with a lot of game design teams, were a lot male dominated, but this is pretty nice that our artist is actually female. And it's kind of interesting because then you're able to get multiple perspectives in terms of gameplay. But yes, good catch. So this is an example of the school scenario, and if you notice on here, you have the cell phone mechanic through which you can kind of have different conversations. So I'll show you some other scenes as you kind of play through whichever levels are most interesting. So this is the example of the bus ride home. Any questions as you look through, and I'm just showing you different clips to help you kind of make sense. So this is a scene where I was saying there's someone else on the bus who also has been injured, and there's that conversation. And that's like the cell phone through which you typically communicate within the game.
In the transition scenes where you're going to get on the bus, they were looking at the bus, but on this level, like, the purpose of to get on the bus, you just keep walking.
We'll show you the last scene.
Students during playtesting to realize how far you can actually go. So on the first level, where they you can pass the kitchen. Yeah.
Yeah, so this is just kind of reminding to get disposal of the medications. So that's kind of all I have. I'm happy to take more questions, thoughts. If this is interesting to you, please feel free to email me. I think I have my email on my slide.
Well, thank you.
Thank you. So this is my email. Feel free to email me with questions or comments. Thank you guys for coming. Appreciate the awesome thoughts.